Welcome to another Arthritis Help Movement Improvement session where you learn to move differently so you can feel better. I'm Dr. Dave, physical therapist, and today we're going to be working on spinal mobility, especially for those of you who might have a scoliosis. Yes, I said it, the S word, scoliosis. Scoliosis is, by definition, quite simply any abnormal curvature of the spine, but most commonly we talk about it in this lateral plane where the shoulders move off one way and the hips move in the other direction. So today's exercise is going to be work on restoring that mobility, restoring the shoulders over the hips, so that way there's a nicer alignment which makes easier movement through the body and easier generation of strength and stability in your core, in your midsection. Having a scoliosis or a mild shift in and of itself is no harm. There's many Olympic athletes even who have some scoliosis, so just having one is not a danger, is not a threat, but the ability to move out of that curvature is really the most important thing. So today we're going to work on getting smooth and moving out of maybe your preferences, out of those curvatures that you're used to get into, and feel how you can feel a little bit taller, stronger, and maybe more stable from that position. All you're going to need for today's session is a wall, so pretty simple. And before we get started, I just want to remind you that I did build a 10-minute-a-day full body strengthening program just for you. You can find the link to it in the details of this video. Click on it, get it downloaded straight to your inbox, totally free, just for you, because I love you so much. Okay, so find your wall and let's get started. So here we are, standing by the wall. You're going to be facing to the side, so your shoulder is adjacent to the wall. And you're going to stand just with a little bit of distance with the feet, so you're maybe a foot away from the wall, so that way when you lean, you'll lean your shoulder into the wall, and you'll have a little bit of a tip or a tilt of your body towards the wall. So we're going to do this leaning the shoulder into the wall, the feet a little further away, so we have this tilt or lean into the wall. And then you're going to take the arm that's against the wall and you're going to bend your elbow to 90 degrees, and you're just going to slightly shrug your shoulder a little bit. So the elbow is against those lower ribs of your body, not down against your hip or into your waist, but a little bit higher into those lower ribs. Your shoulder's against the wall, the upper arm and elbow are against the wall, and you're just going to let your ribs rest into that elbow. Now from here, all you're going to do is relax your body and simply allow gravity to let your hips fall into the wall. And then you're going to back away. As you do that, let the hips fall into the wall and make sure that you don't tilt your head and shoulder away from the wall. You want to, if I put a piece of paper between your shoulder and the wall, or a $100 bill, if that's a better motivator, between your shoulder and the wall, that it wouldn't fall, that it would stay even as the hips come in. And then as you come away from the wall, you're not going to move so far away that there's this gap between your elbow and the ribs. We're going to keep that gap closed. So the gap is closed between the shoulder and the wall and between the elbow and the ribs. And we're just going to make this small movement of relaxing and letting the hips move toward the wall, making this distance smaller between the hip and the wall, and then backing off, but not so much that you pull away from your body, you pull away from your arm rather, and then we come in and come out. Some people like to bend that outside knee. It makes it a little easier to fall in. That is okay. And you're just going to tilt in and out. You're going to notice that when you do this, as you tilt, the pelvis starts to tilt underneath the shoulders or glide underneath the shoulders. And then as it comes back, it's on this, they're kind of disconnected on this line again. They're a little bit more offset. And then they come out. So this is a nice, simple exercise, simple movement, just to help restore this lateral plane mobility through the torso. It's something that we rarely get to do on our own, so taking a few minutes to move in this direction is really nice, especially if you have a scoliosis, but actually even if you don't. I use this for a lot of people regardless of that position or that posture. And just get a sense for how easily your hips fall and how much distance there is towards the wall, and then back off. Good. and then come back up to standing. Good, and I'm just gonna give one little enhancer. If that was enough for you, that's fine. For those of you who maybe that's a little bit simple, we're gonna do the same thing, shoulder into the wall, elbow and forearm into the wall, ribs against that elbow, let the hips fall in, and then if you can, ground your near leg, your leg closest to the wall, into the floor, and allow the opposite leg to lift a little bit and then come back. Right? But make sure that you don't pull away from the wall. As you do it, you let the hips fall into the wall. You can even let your head tilt into the wall and just let that leg come out. And then again, this is kind of the step up advanced version. So if this isn't for you, that is fine. But if you do this easily, that's great. And you come back. We're gonna do 4 more, slide, and then come back. Your leg doesn't have to come off the ground. It's just kind of a slide out, almost like a ballet class. And slide, good. We're gonna do 1 more, just making those left hip muscles work a little bit, and relax, good. And then come back and back to upright. That's all there is to it, just that little bit of shift. We're gonna turn around and do the same thing on the other side, and you might notice that as you do the other side, that the hip it might be a lot easier for that hip to fall into the wall, or it might be a lot more difficult. If there's a big asymmetry between the two, that just means that you have a tendency to be a little bit more offset, and so it's hard to move in one direction and easy to move in the other, and that's fine. It just lets you know that you need to do it a little bit more often into the direction that's challenging, just to kind of restore that balance. So I'm going to turn my back to you just so you can see, and we're going to do the same thing on the other side. So as we're standing from here, about 1 foot away from the wall, or 1.5 feet away from the wall, the shoulder against the wall, the elbow against the wall, a little bit of shrug in the shoulder so that the elbow is against the ribs and not against the waist, all right? And you don't want to be so far back. You want to be just kind of into those ribs. So you're using that elbow as a block, and then you're simply just going to relax your hips and let them fall into the wall. And for me, this direction, much simpler, feels like water, no problem. So I have a little bit of a tendency to offset my shoulders right and my hips left, and that's okay. And I'm gonna go a few more times. As I come away from the wall, I'm not pulling away the ribs from the body. I'm not pulling the shoulder away from the wall. All that contact remains. The only thing that's changing is the pelvis moving underneath the ribs and back. And I'm gonna do a few of these just because they feel nice. And feeling that smooth, easy movement. I'm not trying to push. I'm not trying to find the wall. I'm just going smooth to wherever the movement takes me, whatever it allows me to do. And then back off, and in, and back off. Excellent. And then I'm just gonna back off. Okay, checking in. If you're doing that, you're doing great. We're gonna do the same thing and add that little enhancer of the leg out. So we're gonna bring the shoulder, elbow against the wall. We're gonna let the hips fall in. If you wanna bend that outside knee, you can do that, but just make sure you're not peeling the shoulder away from the wall. You can even try to tilt your head into the wall and a little slide out of that leg and back. And since my hips flow easily in this direction, a lot less work for me to unload this right leg and step it out to the side, because I'm so used to and so comfortable being in this position subconsciously, even though I'm not really aware of it. Let's do 3 more. 1, 2, and 3, and relax. Okay, I'm gonna turn around and face you, and now I want you to compare those two sides and see if they felt even or uneven. For me, with my back to you, it was a lot simpler to move through, so I want you to do whichever side was more challenging. We're gonna do 1 more set on that challenging side. If they both felt equal, that's fine, just pick a side, you can't go wrong. And so I'm gonna do this side again, just so I can feel that comparison. I always love to go kind of compare both sides and then do the challenging side again, because now I feel like I have this model of the good side, or of the easy side rather, that I can work off of, that I can try to emulate, right? I have now a goal. I have you know, an idyllic version that I can try to copy. And so I'm just letting that hip fall in, and I'm feeling that I'm allowing my body the permission by relaxing, not the effort by pushing, not the ambition, but by relaxing in. And I'm not moving into pain, because we don't do that, right? Because rule number one is always be kind to yourself. And so make sure you're being kind to yourself with slow, easy, and smooth movements. I'm going to do 3 more here. 1, and back, and 2. I'm staying into the wall. I even tilt my head into the wall a little bit just to keep me honest. It's hard to pull away from the wall when the head's moving towards the wall. Good, 1 more time. And as I drop in, I'm going to do just 5 little leg slides. 1, good, staying solid through that right leg for me, keeping those hips into the wall. 3, 4, and 5. Excellent. Okay, very good. All right, that's all there is to it. Just that little hip side to side. When I do those, even just that, couple of minutes of movement, I just feel a little looser. I feel a little freer. I feel a little taller, which is good for me. So I hope you enjoyed that. You can work on that daily. All you need is a wall. You don't need a lot of time. You don't need a lot of effort. Just give yourself 30 seconds to practice moving in that direction, and you will feel the difference, I promise you. Thank you so much for joining me today, and don't forget to thank yourself for taking the time for doing the things that are going to make you feel better. Not everyone does it, but you did it, and you will see the rewards. I can't wait to see you all next week when I have a whole new video teaching you how to move differently so you can feel better. Take care.